As a physician, I was trained at a time of economic ignorance. We simply chose the best clinical path and clinical options for the patient to achieve the outcomes we desired. Today, though, that's no longer an option. With the rising cost of medications, patients simply can't afford often the therapies that we're choosing. And study after study has shown that increased copays lead to decreased adherence, and decreased adherence leads to worse outcomes. And in the past, there was really no great way to know the cost of the medication. As a physician, I kind of knew what was more or less expensive and made the best choice I could. But what this would lead to was surprises at the pharmacy. The patient would show up, they'd be surprised at the cost, and maybe they would ask the pharmacist if there was an alternative. Or it could lead to the patient making some really hard choices, choosing between a medication or something as essential as food. Today I want to talk to you about an innovative approach from Surescripts that can help you make better economic decisions for the patient. It's called the Real-Time Prescription Benefit Solution. The way that this works is in your electronic health record, as you're prescribing a medication, and after you choose the drug, the dose, the quantity, and the pharmacy, the EHR will present to you right on your screen the patient's direct out-of-pocket cost. This is a cost that's calculated in the same way the cost will be calculated when the patient shows up to the pharmacy. But in addition to that out-of-pocket cost, you'll see alternatives such as drugs in the same therapeutic class, but that may be at a lower cost. You'll see drugs that maybe don't require prior authorization, but can achieve the same clinical outcome. And all this information is presented in a way that's neutral. It's not influenced by any outside factors other than that patient's chosen benefit plan. And as I talk to providers about using this solution, I'm hearing great results. I'm hearing stories where they're showing the screen to the patient, having a shared decision-making process, and making a choice that's in the best clinical and economic benefit for the patient. For more information, I'd encourage you to talk to your electronic health record vendor, and they can tell you what you need to do to turn this on.